The worst, really, so that's kind of the mechanic, which kind of can be repaired. The worst part was really the concussion. And then if I go back to the accident until Crankworks, because that's really when I started to feel the symptoms of the concussion. Like I was thinking at the beginning that I was not concussed. I was like, oh, I'm fine. But I was completely out of it. Like it was not me at all. And really during Crankworks, that's when everything started to pick up, and I really started to feel some really deep mood swings and depression and anxiety, and I've never felt like that. I've never been someone depressed. And that's really when I realized, I was like, okay, I've heard stories, of like people who've had concussion that are getting depressed. And I will never really understand, because I've never went through it. And then I felt it, and I was like, okay, well, now I understand why some people commit suicide, and it can be really, really bad. So one day, I think it was 2 weeks after Crankworks, I really lost my mind at home, and then I went for a hike on my own with Remy, my dog. Remy, my dog. We can talk about that after. I named my dog Remy. He's going to say that I've named my dog after him, but it's not after.
I'm not saying anything, I don't need to say anything, Yoann.
And then it was really stormy. I went to a peak in the backcountry. It was super stormy, and I remember being up there. I was like, charged with like anger and like not good. And I was like, the storm was coming, and I remember I was like calling for the storm to the lightning to strike me even. And at some point the storm was really coming, and I was like, okay, this is getting dangerous. I need to go back down. And then I went back home. I was still charged and not feeling good. And then I sat down with my wife Jen. And she was like, Yoann, you are not acting like yourself right now. And she said, I think you need to seek help and to see a counselor and maybe go see a doctor. And so that's what I did. And I went to see my counselor, Greg, in Whistler, and we really debriefed and went through the full accident, the traumatic experience of the accident, because I was having flashback of seeing the wood, bah, and the impact sound, like hearing the sound of the impact of the wood. And we walked through all this thing, went to a doctor. I got a low dose of antidepressant drugs as well. That really helped me. And it's really like September, when I was able to gently be back on my bike, that I started to do some gentle rides in Pemberton on my e-bike. E-bikes are amazing for that as well, because if I was pushing really hard on my bike, everything is steep here in the Sea to Sky. So if I was really like trying to climb on my regular bike,
your heart rate
will go up, and then it will bring like a lot of blood flow in my brain, and I will completely feel dizzy, and it will not work well. So the e-bike really helped me to pace myself and go for gentle spin and go for like
just be outside
and nice lookouts and just feeling the nature again and the freedom of biking. And everything really started to ramp up gently in September. And I stopped the antidepressant drugs as well, like pretty much after like 4 or 5 weeks. And things have been way better. Yeah.
Okay, that's good to hear.
But sorry for cutting you, but for me it went relatively well and quick. But really I really did not hesitate to, like seek help.
Yeah.
And I think that's one of the main things, that sometimes people have concussion and they don't seek help. They feel like it's normal and it's going to go away, but it won't. Like
and the tough thing is that those injuries, I mean, every injury is different, but head injuries, you can hit your head really badly and somehow be completely fine. And sometimes it can be just, some things that look super minor that actually have like consequences. And